Hello, my name is Sullivan. I'm here to talk to you about something that's important to all of us. Something that is known as the silent killer. This is also known as hypertension. Hypertension is whenever we consider high blood pressure. Blood pressure is the force that is exerted inside the vessels as you walk around every day. You're sitting here, the pressure is exerted on your arteries, on your veins, and whenever your pressure increases, it's called hypertension. The AHA now recommends that normal blood pressure is anything less than 120 and anything less than 80. Systolic being your 120, your upper number, diastolic being 80, your lower number. This has kind of changed over time from the past. Before it was anything around 120 over 80, but now they actually call you pre-hypertensive if you have anything over 120 or anything over 80. There are some serious complications whenever you allow your blood vessels to be stretched for long periods of time. There's weakness in the vessels. The weakness will actually cause the stretching of the vessels, which can make it weak and also cause a rupture. Some of the words you might have heard before would be like a CVA, which is also known as a stroke. Aneurysms, you can have those that can occur throughout your body, like in your abdominal area. Another thing that's a concern is plaque. Plaque can build up in your arteries. All these things can lead to a heart attack, or also known as a myocardial infarction, angina, which is just like the preliminary form of a heart attack. It's congestive heart failure. Also a biggie is renal failure. The American Heart Association says that out of 100 deaths, 18.5 of those are related to hypertension. One of the big concerns here in the city are dialysis patients. We have a very large dialysis population here. DaVita is one of the larger companies here. They estimate that $320 billion a year is actually what is spent for dialysis patients, and most of those are related back to the hypertension. Also, hypertension is considered the second leading cause of end-stage renal disease, and someone dies from this every 90 seconds across the United States. There are lots of things that we can do to help resolve hypertension. Most of us are pretty knowledgeable about the fact that your diet and your exercise are two major components to hypertension. If you eat the proper diet and if you exercise, they recommend at least 3 times a week with at least 30 minutes of cardiovascular, some type of aerobic exercise. That will tremendously help decrease your hypertension risk. The fact that some people have a hereditary issue, those are some things that we cannot prevent, but that's all the more important for you to make sure that you take your medicines and you follow up with your doctors. In conclusion, one statistic that we learned is hypertension kills more than any other disease. It's kind of shocking when you think about cancer and some of the other diseases, but hypertension kills more than any other disease. Simple things can help change this for you, such as simply your diet and just a little light exercise can dramatically affect your life.